Madam Gracy Mathai, who is the CEO of Baby Memorial Hospitals, Kerala. Madam Gracy, thank you so much for being here. First of all, it's my privilege and honor to introduce you today. She has completed her graduation in nursing, followed by MHA from TITS, Mumbai, MHRDM from Mumbai University. She has also completed postgraduate diploma in medical law and ethics from National Law School, Bangalore. She's also a certified green belt in Six Sigma, lead auditor, ISO 9001-2000 and 1401. In the past, she has worked as a group quality consultant, chief operating officer, and hospital administrators of various prestigious organizations, including Astrodm Hospitals and Leelavati Hospital. She is also an accreditation coordinator and survey coordinator for NABH and JCI. She has completed 2 terms serving as a member of technical committee and accreditation committee for NABH, and presently serving as a co-chair for accreditation committee and chair for CAHO member state Kerala. We are eager to hear from you, ma'am, on nursing assessment in elderly. Over to you, ma'am.
Especially in managing the elderly is laid on the nurses. Whatever we said and done, and whatever we see in the emergency, in the critical care, as well as in the routine, or we may think about even in a family, the important role of nurse is very vital, and that we may have to look into, and that we will be looking now this coming 20 minutes. It refers to the systematic process of gathering relevant information about the health status, functional abilities, and psychosocial needs of older people, and along with the doctors, other social workers, and other healthcare workers, nurse is the most important person who see that these aspects have been done. Rather, I can say the assessment is mainly the responsibility of the nurses. Now, the purpose of this assessment is to understand the unique need of the elderly and the challenges what we are facing in order to understand this unique need. Because if it is of any other category, they will come and tell us, but here their memory problem, their age problem, other comorbidity problem, all these things will prohibit them in explaining about their needs. So it's little difficult for us. Again, with this assessment, we will detect the potential health problems of our elderly. And again, it will help us to develop an individualized care plan. The objective of nursing assessment is to understand the significance of nursing assessment in the elderly population, to identify key areas to assess in the nursing evaluation for older adults, and to highlight the assessment tool and scores used in geriatric nursing assessment. So the topic of mine is mainly deal with the tools as well as the scores of the elderly people assessment. Now, the importance of nursing assessment in elderly are the early detection of health issues, tailoring care plans to individual needs, monitoring changes in the health status, and facilitating appropriate intervention. And you will agree with me, all these 4 aspects are very important to manage the elderly people, whether it is in an emergency department, or it's in an old age home, or it's a hospice area, or it's in the critical care area. Now, key areas of nursing assessments, we can see there are 10 key areas are there. When we assess, we have to focus on these 10 key areas, like health history, their cognitive function, their physical assessment, their mental health, fall risk assessment, functional abilities, social support and resources, mainly the availability of social support and resources, medication review, nutritional assessment, and palliative care and needs. Now let us look into little detail of each one of these things. Health history. We have to gather a detailed health history of our elderly, specifically regarding their past illnesses and the past illnesses, what treatment they are on, any past surgeries have been there, are they allergic to any drugs or any other substances, what are the current medication where they are using at the moment. All these help us to identify their potential health risk and guide us in appropriate care planning. When we look into the cognitive function, assessment of the cognitive function, it will help us to identify conditions related to dementia and delirium. Specifically, their memory. Are they have a proper memory of their past, even certain things which has happened in their own life, in their own family, in their own professional life? Are they oriented about the situation, the day, the week, the month? Are they oriented? Are they concentrate or can attend to the minute details or a broader details? Is there any language barrier for them? Because maybe their hearing capacity may be less, seeing capacity may be less, all the capacity of their senses may be less. So in our usual talk, that may be difficult for them to understand. So how we can handle that? And specifically for some people, even the language problem is also there. So how we can handle that? And again, their abilities to solve their own problems. Can they do it by themselves or they require help of others? So these things we can see by the assessing the cognitive function. Coming to the third one, that is a mental health. Assessing elderly person's mental health include their mood. Yes, they are always not in the same mood. Maybe morning it may be different, afternoon it may be different, and evening may be something different. Or maybe some days it may be different and some days it can be different. So what is their mood? Sometimes they may be in the mood of a small child. Sometimes you can see them, they look like an adult, or sometimes even an elderly person who have forgotten everything, who don't know many of those things. That way also you may have to look into. And then again, their emotional well-being. When they were young, as well as when they were children, emotionally maybe well-built, well accepted. Whereas as they pass on towards the elder age, are they emotionally stable? Can you talk in the same way as you talk to them when they were in the adulthood? So we may have to understand their emotional well-being. Do they have any signs of depression? Specifically, this is one of the main things what we can see the elderly, they go into depression. Why they go into depression? Maybe feeling of loneliness, feeling of non-acceptance from the family members, having no job, or maybe dependability to someone else, maybe to the peers, or maybe to the children. So all these reasons can be there. They may go into depression. And of course, they are also always anxious. They don't know what will happen to them. They don't know if something happened, who will take care of them. They don't know, can they walk properly? Can they eat properly? What they eat is correct. So they are always anxious, or even the medication what you give to them, whether that is an apt medication, that also they are not knowing. So there is an anxiety, and of course other psychiatric conditions. So the mental health assessing, we may get to know all these things. Then they are more prone to fall risk. So fall risk assessment is very important for the elderly. You know that they will have problem with their balance, with their gait, with their mobility, with their vision. So fall can come at any time. So fall risk assessment is very, very important for the elderly people. Physical assessment, yes, like Dr. Sharma was also talking about the physical assessment. You have to go for a detailed physical assessment, like your vital signs, your overall appearance, the skin integrity of the person, the mobility as well as the capacity of their mobility, sensory function of the elderly, nutritional status of the elderly, any signs of discomfort or pain. Sometimes they may not be able to tell us about the pain and discomfort, but their action, but the way they lie down, the way they talk, the way they look at you, you will discriminate. You can see that are they discomfort, are they in some pain. So this physical assessment also will help us to understand these things. Now their functional abilities, this is very important. In the functional ability, we can look into two important things. One is activities of daily living, which include their bath, their dress, their eating, as well as use of toilet. It means, can they take bath independently? Can they dress themselves without the help of others? Can they eat their food when it is been given to them? Can they independently use the toilet, or do they need some help? So these are their activities of daily living. This one we can observe in the functional ability. The next is the instrumental activities of daily living. This will be little deeper level than the activities of daily living. Here we may analyze their managing capacity on finance, like how they calculate finance, how they handle finance. Can they handle finance? Can someone cheat them of financial affairs? When someone asks or they ask, what is the cost or what should be given for this? Can they correctly understand, or can they deal that correctly? Even can they handle their bank affairs? All those things will come into instrumental activities. Along with that, shop for groceries. Can they go to the shop? Can they ask, yes, XYZ, these things I require, and what is the cost of those things? And accordingly, no one can fool them, and they can take it independently. The next thing can be, can they prepare their meals? May not be an exhaustive meal, what you and I may think. That's not an exhaustive meal. At least to some time, they can boil the milk. They can prepare little tea. They can prepare some small items for them. May not be a big item, but that can they do that? Can they handle the fire? All those things we may have to analyze with this instrument. And of course, perform little household tasks like cleaning the toilet, cleaning the rooms, washing maybe their underclothes, maybe cutting the vegetables or helping the maid. So those household work, how much they can do, that also we assess by using this tool. Next is their social support and resources. This is very important, and it plays a very important role also. Now, is there any social support network around them? Who can help them? Or what is their living situation? Do they have some helping hand? If at all they are staying alone, do they have some comfortable neighbors? Do they have some relatives staying nearby? Do their children living nearby, and who can come and help them? Do their siblings living nearby and they can come and help them? Or is there any social agencies who come and visit these people regularly, and then they can take care of these people? So that also we will look into. Then access to the community resources. What all community resources can be available for them to use it maybe for today or maybe in the next time, because these community resources ultimately will help them in the absence of their near and dear ones along with them. Caregiver availability. You know that nowadays it's a fashion that our elderly have been placed into old age home. Why? There is nobody in the family to take care of them. So at least you are happy that there is someone in the old age home to take care of them. Where some people, what they do, they are alone in their family, but they ask someone else to come and help them in their family. I know there are some children, when they know that their parents are alone, they keep some help in the house itself, so they can take care of them. And again, you can assess and see that if there is any potential gap in support and they need an additional service or intervention, in that case, we can have some people, or we can approach some people and we can tell them to help these people. Then the nutritional assessment is another assessment. Their malnutrition risk, because they don't know what food they are taking is of nutritious. The proper amount they may take, but we don't know the nutritive value of that food is correct. Then whether their hydration status is proper, dietary is appropriate, modification need to be there in their nutritional, because their carbohydrate things may be fulfilled, whereas protein requirement may not be fulfilled. So those things we will check during the nutritional assessment. Now, palliative care and needs. Palliative care and needs, their pain management, their symptom control, end of life preferences. Like just now, Dr. Padiva have asked like advanced directive. So is there any such things are also there? That also we will look into their palliative care and needs. Medication review, specifically, are they into some medication? Are they aware that how this medication need to be taken? Do they take some over-the-counter drugs or some herbal supplements? This also we will come to know when we do their assessment. Am I audible? Hello?
Madam.
Yes, ma'am.
Okay. Now we will come to the important tools as well as the scores, what is being used for these people. We have seen the 10 level of assessment. In order to do those 10 assessment, there are various tools are there, like activities of daily living ADL, instrumental activities of daily living IADL, mini mental state examination MMSC tool, geriatric depression scale, that is GDS, fall risk assessment tools, and the pain assessment tools. Let us look into each one in little time. Like first one, activities of daily living, which we have already seen that whether they can bath there, they can eat there, they can go to toilet. So these particular tools we will use to see that whether they can practice and where they stand with this tool. Now, there are different types of tools available. If you look into the Google and if you look into the thing, you can take any of the tool. I just took one where their personal hygiene, continence, dressing, transferring, feeding, and mobility of those people can be judged. Again, it can be like in the right-hand side, what you can see, the bathing, going to the bathroom, getting dressed, personal hygiene, moving ahead from bed to bathroom, preparing food, all those also there in some tool where you can use these tools also. Now, but before using these tools, you and I have to understand what is this tool, then only we can use it properly. Now, the scoring of this tool are like 4, 3, 2, 1. Independently, when they can handle, we can give them 4 score. They are independent, but under supervision, we can give them 3. They require help of one person, we can give them 2 score. Of course, they require the help of not only one person, they cannot move at all, and we can give them 1 score. So that is, there are 3 different types of score I have mentioned over here. So you can use any of this score, and then you can identify what is their activities of daily living capacity. Now again, there are some additional things are also seen in the Google. You can again look into that. I'm not going into detail, like independent, modified independent, supervision or setup assistant, limited assistant, extensive assistant, and total dependence. So that way tools are also available. That is 6 scales tool. We can use that 6 scale tool also. Coming into the second tool, that is the instrumental activities of daily living. Specifically, we have seen like managing their finance, transportation, meal preparation, medication management, housekeeping and home maintenance, communication and technology use. This also, there is a scoring available where they are completely independent. They are able to perform the activity without any assistant. You can give them 3. This is one scale. There are many other scale of IADL also. And then require assistant, you can give them 2. And unable to perform, you can give them 1. Now, the third is the MMSE, Mini Mental State Examination Tool. And this is particularly used to know the cognitive conditions of a patient, our elderly. Specifically, the cognitive conditions like orientation. Are they oriented to the atmosphere? Are they oriented to the day's time? Their memory, their attention, their language, and their visuospatial abilities. So for that purpose, we use this MMSE school. It has questionnaire which can give you a range from 0 to 30, or some tools are there which may give a questionnaire ranging from 0 to 15 also. Whichever is there, we can use. Here is example of 1, 0 to 30. Like you are going to ask them what is the year, what is the season, what's the date, what's the day of the week, what's a month. If they can say all these 5, you will give them 5 score. Like it goes on like this. Where are we now? The state, country, town, city, hospital, floor, whatever. If they remember, you can tell them. You can again tell them 3 unrelated objects. This unrelated object can be, it is not related, like one can be a table, one can be a pen, one can be a fan or whatever. You can use 3 things. And you can ask them to remember, are they remember those things? If they remember, then you can give them 3 like. You can ask them to count backward from 100. So count backward from 100, you can ask them. And once they know that 5 number they have counted, it's okay, you can give them 5. And then earlier you have told them these 3 things. After some time you can ask them, do you remember what I told you earlier, those 3 things? If they remember. So this is the scale which is used for MMSE, and this will give you a total score of up to 30. So this is another score for cognitive response. This again another score for cognitive response. Now coming into the next score tool, that is the geriatric depression scale tool. This also will have a scale of 15, or this have a scale of 30 items. As I told you, there are various reasons are there where our geriatric patient may be depressed. In this case, we are just asking them some questions and we expect them from them either yes, no, or not sure. Only these 3 things we expect from them. So here there are 15 questions. We just ask them.
Madam,
yes,
just have 3 minutes left, ma'am.
No, it's complete. It's
yes.
finished.
Yes.
So are you basically satisfied with your life? Do you often feel helpless? Do you feel that you have more problem with memory than most? You can ask these questions and they may either tell you yes, or they will tell you no, or they'll tell you not sure. So this is another form of that, what you can see over here. Fault risk assessment, all of you know that I need not elaborate. There are fault risk assessment tool, and it is one of the important tool which we have to use. Like Morse fault scale is there, timed up go set tool is there, Berg balance scale is there, Henry's 2 fault risk model. There are many, whatever is convenient for you, you can take it and you can use for their fault risk assessment. You can use this. Pain assessment also, you are aware that pain and assessment tools are there and which you are day-to-day using in your healthcare. So with this, like numeric rating scale, verbal descriptor scale, McGill pain questionnaire, visual analog, brief pain inventory, color analog, all these things are there. These are scored in a different way. So coming into finally, in conclusion, nursing assessment play a crucial role in ensuring the well-being and safety of elderly individuals. This comprehensive evaluation provides valuable insights into their physical, psychological, social, cognitive health, allowing healthcare professionals to tailor their care plan to meet their unique need. And through meticulous examination of functional abilities, chronic conditions, medication management, fault risk, and cognitive status, nurses can identify potential health issues early and implement timely intervention and prevent adverse outcomes, and our elderly will be very happy. Thank you for your patience listening.